Welcome to the deep dive. Today, we're really getting into the mechanics of reproduction, specifically male fertility. We're doing a deep dive into stallion
It's
spermatogenesis.
a fascinating area, really
Yeah,
intricate biology at work.
absolutely. And our mission, like always, is to take this stack of material, research papers, articles, expert notes, and pull out the key insights for you.
Yep, cutting through the jargon.
Exactly. We're decoding how stallions actually make sperm, what factors influence it all, and what happens when things maybe go wrong.
It's like getting the Cliff's Notes, but, more interesting.
Hopefully, think of it as your shortcut to being really informed, maybe with a few surprising facts along the way.
Sounds good.
Okay, so let's unpack this. What exactly is spermatogenesis?
Well, basically, it's the biological process, the factory, if you like, inside the testes, specifically in the seminiferous tubules that produces spermatozoa.
Sperm, right, the sperm factory. But it's not just one step, is it?
No, not at all. It's quite complex. First, you have stem cells,
Yeah.
the spermatogonia, dividing through mitosis, just making more of themselves.
Yeah.
Then those cells go through meiosis. That's the special division that has the chromosomes becoming primary, and then secondary spermatocytes.
Uh-huh.
And those eventually form spermatids. But they're not quite sperm yet. They're sort of roundish cells.
So the final...
That's spermiogenesis. It's this amazing transformation where the round spermatids mature, get their tails, streamline, basically become the spermatozoa that can swim and fertilize.
That whole sequence. How long does that actually take?
What's truly fascinating here is the timing. It's remarkably consistent. That whole production line, from the initial spermatogonium to a spermatozoa ready to leave the tubule, takes about 55 to 57 days.
57 days. Wow.
But wait, there's more. They're not quite ready for ejaculation then. They need to mature further in the epididymis.
Ah, okay.
That takes another 9 days or so. That's where they really gain their proper motility and the ability to fertilize an egg.
So add it all up.
You're looking at roughly 60 to 70 days total from the very start of the process to a fully functional, ready-to-go sperm cell in the ejaculate.
That has huge implications, doesn't it? It means any problem, say a fever or some kind of stress today.
You won't see the effect on the semen quality for about 2 months.
Right. It's like a delayed report card. You can't just react instantly.
Exactly. It forces you into a longer-term view of management and observation. Prevention becomes key.
So this factory isn't running on its own. You mentioned support cells.
Precisely. Spermatogenesis doesn't happen in a vacuum. It absolutely depends on specialized somatic cells within the testes, mainly Leydig cells and Sertoli cells.
Let's start with Sertoli cells. What's their role?
Okay, Sertoli cells are inside the seminiferous tubules, right alongside the developing germ cells. Think of them as the nurse cells, the structural and physiological support system.
Nurse cells. I like that.
A really critical job they have is forming the blood-testes barrier.
Why is that barrier so important?
Well, the developing sperm cells are genetically different from the stallion himself. The barrier isolates them from the stallion's immune system, preventing it from attacking them as foreign invaders.
Ah, makes sense.
Sertoli cells are regulated mainly by FSH, follicle-stimulating hormone, for the pituitary. And they produce some really crucial factors themselves.
Like what?
Things like inhibin, which feeds back to regulate FSH levels, and androgen-binding protein, ABP. This is vital. It concentrates testosterone right there in the tubules, bathing the developing sperm in the high levels they need.
So it keeps the testosterone where it's needed most.
Exactly. Plus, other factors like activin and insulin-like growth factor, IGF, they're constantly managing that microenvironment.
Okay, and the Leydig cells, where do they fit in?
Leydig cells are found in the spaces between the tubules, the interstitial compartment. Their main job is making hormones.
Testosterone, primarily.
Testosterone, yes, that's the big one. But they also produce estrogens. They respond mainly to LH luteinizing hormone, also from the pituitary.
And that testosterone.
It's absolutely essential for driving spermatogenesis within the tubules. But it also travels through the bloodstream and tells the brain, the hypothalamus and pituitary, to ease up on producing GnRH and LH when levels are high enough. It's part of that HPT axis feedback loop.
HPT, hyperthalamic pituitary testicular axis.
Correct. It's this whole hormonal communication network that keeps everything balanced.
So what does this all mean? If one part of this system gets disrupted, say the Sertoli cells aren't working right, or LH levels drop.
It can definitely cause a cascade effect, disrupt one component, and it impacts the whole spermatogenic process. It highlights just how finely tuned testicular health really is.
And this hormonal control, this HPT axis, can you break that down a bit more?
Sure, think of it like an orchestra. The hypothalamus is the conductor, releasing GnRH, gonadotropin-releasing hormone impulses.
Okay, the conductor waves the baton.
And that signals the anterior pituitary gland, the lead section. The pituitary then releases LH and FSH.
So,
Kind of. LH primarily talks to the Leydig cells, telling them to make testosterone and estrogens. FSH mainly targets the Sertoli cells, supporting sperm development and inhibin production.
and then the feedback loops kick in.
Right. Testosterone from Leydig cells is crucial for the sperm, but it also signals back to the hypothalamus and pituitary to say, okay, we have enough. Estrogens also modulate LH and FSH. And inhibin from the Sertoli cells specifically tells the pituitary to reduce FSH release.
It's a constant conversation.
A very precise hormonal symphony.
Yeah.
And even things outside this core axis play a role. Melatonin, for example, which increases in darkness.
That's linked to seasonality, right?
Exactly. Melatonin can lower GnRH release, which contributes to that dip in sperm production we see during the shorter days of winter.
Which brings us neatly to those broader factors influencing fertility. Age is always a big one.
Definitely. Spermatogenesis usually starts around 12 to 14 months of age puberty, but reaching full adult production levels, that takes longer. We're talking about hitting that peak output, maybe 14 to 18 million sperm per gram of tissue per day, usually when the testes reach a certain size, often around 3 years old. Though some might take longer to reach peak numbers even if the size is there.
So 3 isn't necessarily fully mature, reproductively speaking?
Often, full maturity for sperm production is considered closer to 6 years old. Interestingly, production can actually keep increasing even past 12 years in some stallions, although you might see a slight decrease eventually in very old age.
Which really underscores the need for regular semen checks, especially with older, valuable stallions. You can't just assume.
Absolutely. Routine evaluation is key.
And you mentioned seasonality and melatonin. How much does day length really impact things?
Significantly. Stallions show a clear annual rhythm. Sperm production can drop by roughly half during the non-breeding season, typically September through February in the Northern Hemisphere. It peaks around May and June.
Driven by that melatonin response to darkness.
Largely, yes. Less daylight means more melatonin, which tends to suppress the HPT axis.
But we can manage that, right? Artificial lights?
We can. It's a common practice.
Well, yeah.
Using artificial lighting to extend the perceived day length to about 16 hours.
Starting when?
Ideally, you'd start around December 1st. This tricks the stallion system into thinking spring is arriving early, boosting semen production, and advancing the breeding season.
Useful for meeting breeding timelines.
Very. But there's a catch. You don't want 24 hours of continuous light.
Oh, why not?
Paradoxically, continuous light can actually decrease production. They seem to need that cyclical pattern of light and dark for the system to function optimally. So, 16 hours light, 8 hours dark is the usual goal.
Interesting. Okay, another major factor, temperature. You hear a lot about heat stress.
This raises an important question because, yes, temperature is critical. Spermatogenesis works best at a temperature that's actually 2 to 4 degrees Celsius below the horse's core body temp, so around 35 degrees C.
Why is heat so damaging?
It causes multiple problems. Testicular hypoxia, lack of oxygen. It can trigger apoptosis, which is programmed cell death. It might even damage the DNA in sperm. And it can directly impair how well the Leydig and Sertoli cells function.
And it doesn't take much, does it?
No. High-intensity exercise can easily push core body temperature over 41 degrees C. Even small, repeated increases in scrotal temperature, just 1.5 to 2 degrees C, can reduce fertility. Even wearing a suspensory during exercise can raise scrotal surface temp by 2 degrees.
Which cells are most vulnerable?
The early-stage cells, the spermatogonia and spermatocytes, seem to be highly susceptible to heat damage. Remember that 57-day lag time. The damage done today shows up 2 months later.
So mitigation is key. What can be done?
Well, antioxidant supplementation can help combat the oxidative stress that often accompanies heat stress. Things like vitamin C, melatonin. Some studies even suggest certain herbal extracts like Korean red ginseng or chrysanthemums might help. Zinc is important too.
And practical management.
Absolutely crucial. Providing shade, removing suspensories right after work, ensuring good hydration, using cooling methods like hosing down the scrotum or applying cool packs, adjusting exercise intensity in hot weather, making sure trailers are well ventilated during transport. All important.
You mentioned oxidative stress there. Is that a big underlying issue?
It's a huge threat. Think of it as cellular rust. Stallion sperm are particularly vulnerable because their membranes are packed with polyunsaturated fatty acids, which are easily damaged by oxidation. Plus, they have a high metabolic rate, naturally producing reactive oxygen species.
So anything that increases stress, heat, inflammation, intense exercise amps up that oxidative damage.
Exactly. And that damage affects everything: membrane integrity, motility, DNA integrity. This is why antioxidants like vitamin E, vitamin C, and alpha-lipoic acid are so important both preventatively and therapeutically.
Which ties into nutrition overall. What does this all mean for feeding stallions?
It means optimal nutrition is a cornerstone. You can't build a high-performance factory with poor raw materials. Undernutrition can delay puberty and cause actual degeneration.
Are there specific nutrients that are extra important?
Yes. Beyond just a balanced diet, certain things stand out. Zinc is involved in so many enzymes crucial for sperm production. Selenium, manganese, chromium, copper are vital trace minerals. Vitamins A, D, E, and the B vitamins like B12 and folate, B9 are essential.
What about fats and proteins?
Definitely. Adequate protein and specific amino acids like arginine are needed. And fatty acids are really important, especially omega-3s, particularly DHA.
DHA, what does that do?
Studies show DHA can improve sperm numbers, overall quality, motility, and even help protect sperm membranes during cooling and freezing for AI.
Makes sense. And general health. If a stallion is sick?
His fertility often takes a hit. Systemic illness, especially with fever, raises testicular temperature. Prolonged stress isn't good. Even just advanced age can lead to declines.
Specific problems?
Things like infections or orchitis, which is testicular inflammation, or epididymitis can directly damage the reproductive tissues. Chronic stress seems to negatively impact sperm quality. And obesity might indirectly cause problems through insulation, leading to higher testicular temp or increased oxidative stress.
It really shows how fertility is a window into their overall health, doesn't it? Requires a holistic view.
Absolutely. You can't just focus on the testes in isolation. It's about the whole horse, the whole system. Adjusting workload, cooling, nutrition, stress reduction, they all play a part in supporting testicular function.
Okay, let's shift gears slightly. What happens when things go fundamentally wrong with the factory? Let's talk disorders. Testicular degeneration, TD, seems common.
It is, unfortunately. It's a frequent cause of acquired infertility, and it's often progressive, meaning it gets worse over time.
What causes it?
A whole range of things.
Okay.
Trauma, heat, cold, toxins, radiation, poor blood flow, nutritional issues, infections, autoimmune problems, even tumors. Giving external androgens, like steroids, can also shut down natural production and lead to degeneration.
How does it show up?
It can be insidious. Often, the first sign is just a gradual decline in semen quality, lower numbers, poorer motility, more abnormal sperm. Later, you might actually feel the testes getting smaller or softer.
And that 57-day lag again.
Exactly. Significant damage can already be done before you see obvious signs in the semen or feel changes in the testes. It hammers home why regular, careful semen evaluation is so critical for breeding stallions. Catching those subtle early declines is key.
What about other common issues? Cryptorchidism.
That's when one or both tests don't descend properly into the scrotum. It's a developmental issue, often heritable. The retained testes produces testosterone, so the horse acts like a stallion. But because it's at body temperature, it doesn't produce fertile sperm.
Infections.
Yes, bacterial or viral infections can cause orchitis, seminal vesiculitis, inflammation of the seminal vesicles, or epididymitis. All can severely impact fertility.
Trauma. A kick from a mare.
Those are emergencies. Any significant trauma to the scrotum or testes needs immediate veterinary attention to try and salvage function.
And genetics.
Sometimes there are underlying genetic abnormalities. Things like incomplete acrosome reaction or IAR, which affects the sperm's ability to fertilize. There's a potential link to a gene called FKBP6, or more major chromosomal issues like XXY syndrome, known as Klinefelter's in humans.
When you look at the semen itself, what are the specific problems you might see? Isospermia, no sperm at all.
Right. Isospermia is the complete absence of sperm. And it's vital to figure out why. Is it obstructive or non-obstructive?
Meaning?
Obstructive means there's a blockage somewhere preventing sperm from getting out, maybe plugged ampullae, for example. These can sometimes be fixed surgically, so the prognosis can be better.
And non-obstructive.
That means the factory itself is shut down. The testes aren't producing sperm, perhaps due to hormonal issues, genetics, or severe damage. The prognosis here is generally much poorer.
How do you tell the difference?
Here's where it gets really interesting diagnostically. There's a test for an enzyme called alkaline phosphatase, ALP, in the seminal plasma.
Yeah.
Yes. ALP levels are normally very high in fluid from the epididymis and testes. So if a stallion is a zoospermic but has low ALP in his seminal plasma,
It suggests a blockage. The fluid isn't getting through.
exactly. It points strongly towards an obstructive cause. But if the ALP is high in an azoospermic sample,
It means the fluid is there, but the sperm aren't being made in the first place. Testicular failure.
precisely, it points to a non-obstructive primary testicular problem. That ALP test is incredibly useful for diagnosis and prognosis.
Clever. What other sperm issues are there?
You might see necrospermia, lots of dead or immotile sperm, or acinozoospermia, poor progressive motility, meaning they swim weakly or in circles.
Not getting anywhere fast.
Right. Then there's teratozospermia, a high percentage of abnormally shaped sperm, misshapen heads, bent tails, things like that.
And low count.
That's oligospermia, generally defined as less than 15 million sperm per milliliter and considered severe below 5 million. It can be caused by hormones, lifestyle factors, infections, or things like varicocele, swollen veins in the scrotum.
So, faced with potential infertility, how do vets approach diagnosis systematically? It really starts with a thorough breeding soundness examination, or BSE. It's comprehensive.
Much more than just collecting semen.
Exactly. It involves getting a detailed history, illnesses, injuries, medications, a full physical exam, checking for any conformation issues or inherited problems. Then a careful examination of the external genitalia, palpating the testes for size, consistency, freedom of movement, checking the penis and prepuce.
Internal palpation too, usually.
Yes, rectal palpation to assess the internal structures like the seminal vesicles and ampullae, plus taking swabs for microbiological culture, assessing libido and mating ability is also part of it, and then the semen collection.
Typically 2 collections, about an hour apart.
Right, to get a better picture of his daily sperm output potential, and that collected semen gets analyzed. What are the key parameters?
The cornerstone is the semen analysis. You look at the gross appearance color, contaminants, measure the gel-free volume, determine the sperm concentration, aiming for that 100-400 million per ml range, typically.
Motility and morphology.
Critical. Assessing both total motility and, more importantly, progressive motility sperm, moving purposefully forward. Usually want at least 60% progressively motile. And morphology, evaluating the percentage of normally shaped sperm, again, ideally 60% or more normal. And checking for contaminants like white blood cells, urine, or blood.
But diagnostics go beyond that basic analysis now, right?
Oh, absolutely. What's fascinating here is the range of advanced tests we can use now for deeper insights.
Such as?
Well, more precise testicular size measurements, like total scrotal width, correlate well with sperm production. Then there are specialized sperm function tests. The sperm chromatin structure assay, SCFA, looks at DNA fragmentation or damage.
DNA integrity, okay.
Fluorescent stains can assess membrane viability, archrosome status, mitochondrial function. The hypoosmotic swelling test checks membrane integrity. We can even test sperm capacitation and acrosome reaction, or do a sperm zona binding assay to see how well sperm interact with an egg coating.
Wow, really drilling down.
And there's more. Transmission electron microscopy, TEM, gives incredibly detailed images of sperm ultrastructure. Chromosome analysis can identify genetic causes. Testicular biopsy allows direct histological examination of the tissue.
Biopsy, looking right inside the factory.
Exactly. Plus, hormone analysis, baseline levels, or response tests using GnRH or HCG. Ultrasound to visualize internal structures. And as we mentioned, that crucial ALP test for azoospermia. Even urethral endoscopy, if you suspect something like hemospermia, blood in the semen.
It's like a full diagnostic toolkit. And knowing that 57-day cycle, early and accurate diagnosis seems paramount.
Immensely valuable, because conditions like testicular degeneration can creep up slowly. Proactive, regular exams using these tools can identify subtle declines long before a major, potentially irreversible damage sets in. It allows for a much earlier intervention.
So once you have a diagnosis, what are the treatment or management strategies? How do you chart a course forward? The first step is always trying to identify and eliminate the underlying cause, if possible. Beyond that, it's often about supportive care.
Right. That might involve rest, maybe specific antibiotics if there's a confirmed infection, anti-inflammatory drugs, pain relief.
And that holistic approach we talked about.
Absolutely central. Adjusting the horse's workload, providing proper cooling, ensuring top-notch balanced nutrition, minimizing stress. These aren't just extras. They directly support testicular function and recovery.
What about hormonal therapies?
They can be useful if there's a diagnosed hormonal imbalance. GnRH analogs might be used to stimulate LH and FSH. Careful short-term testosterone might be considered in very specific situations, but usually you avoid giving androgens. Dopamine agonists like cabergoline can treat high prolactin levels.
Anything else on the hormone front?
There's some exploration, mostly based on human studies and off-label for horses. of using things like SERMs, selective estrogen receptor modulators, or aromatase inhibitors to try and boost natural gonadotropin production by blocking negative feedback. But that's less established in stallions.
Nutrition and environment seem like areas with direct impact.
Definitely. Targeted supplementation is often key. Omega-3s, especially DHA, are important for membrane health and motility. Antioxidants, vitamin E, C, alpha-lipoic acid are critical for fighting oxidative damage. Ensuring all the basic vitamins and minerals are covered is fundamental.
And managing the environment?
Artificial lighting programs, that's 16 hours of light to combat seasonal dips. And actively managing heat stress shade, cooling, removing suspensories, adjusting exercise, all those practical steps we discussed are vital management tools.
Sometimes surgery is needed.
Yes, for physical issues. Correcting obstructive azoospermia, like unblocking plugged ampullae, is a surgical procedure. Treating varicocele might involve surgery. Testicular biopsy, while diagnostic, is surgical. And of course, immediate surgery might be needed for traumatic injuries.
What about when natural breeding or standard AI isn't enough? Assisted reproductive technologies.
Yes, RH are incredibly powerful tools. If we connect this to the bigger picture, they can help overcome significant subfertility and also accelerate genetic progress by allowing wider use of valuable stallions.
What techniques are we talking about?
Things like teased testicular sperm extraction, getting sperm directly from the testis tissue. This is often combined with ICSI, intracytoplasmic sperm injection, where a single sperm is injected right into the egg.
ICSI is becoming more common, isn't it?
Very much so, especially for stallions with low sperm numbers or poor quality. Then there's standard IVF, in vitro fertilization, though ICSI is often preferred in horses, and IUI, intrauterine insemination, placing sperm directly in the uterus. Plus, advances in semen processing and embryo freezing, vitrification, have made these techniques more successful.
But there are ethical thoughts there, right? With using sperm that might carry genetic defects.
That's a really important consideration.
Mm-hmm.
RTs allow us to achieve pregnancies from stallions who might otherwise be infertile due to, say, severe sperm defects. If that defect has a genetic basis, using RTs could potentially perpetuate that genetic issue in the offspring and the breed.
So careful screening and consideration are needed.
Definitely. It requires a thoughtful balance between helping an individual animal reproduce and considering the long-term genetic health of the population.
And finally, general supportive care.
Always important. Using antibiotics judiciously when needed. Anti-inflammatories and pain relief. Lifestyle adjustments like maintaining healthy body condition, reducing stress, even good fly control to prevent irritation or disease transmission can play a role.
We have certainly covered a lot today. It really paints a picture of stallion spermatogenesis as this incredibly complex, sensitive process and that 57-day time lag. It just changes everything about how you approach problems.
It really does. It emphasizes patience and proactive monitoring.
And it drives home that fertility isn't just about the plumbing. It's a reflection of the stallion's entire health status. So what does this all mean for you listening? I think it's a fascinating look at how interconnected biological systems are and why a holistic approach to health is so vital.
Definitely. And this raises an important question, doesn't it? While we've learned so much and have these powerful tools, the journey isn't over. Research continues. We still need better, earlier biomarkers for things like testicular degeneration.
Catching problems sooner.
Exactly. And we need a deeper understanding of the genetic basis for some types of infertility to make better breeding decisions. Plus, fully understanding the long-term impacts of using ARTs, especially regarding genetics, is crucial.
Future directions.
Oh, there are exciting possibilities. Things like using AI, artificial intelligence, for more predictive health management, maybe even regenerative medicine approaches down the line to actually repair damaged testicular tissue. There's always more to learn to help ensure the health and future of these amazing animals.